Thank you.
Thank you, Senator Rosen. Senator Loeffler.
Thank you all for being here and for your service. Admiral Giroir, before I start my questions, I want to recognize your new role as the U.S. representative to the World Health Organization. Mitigating a resurgence of this pandemic will take global cooperation. In order to do that, we need accountability and transparency at the WHO. This organization was established to ensure the timely flow of accurate, unbiased information on global health emergencies just as this. Reforms must be made in order to restore the trust that we need here. I hope you'll work with our allies to push for these reforms. This question, I have two questions. The first one is for Dr. Redfield. And Dr. Redfield, Georgians are wondering how we got here today. 1,400 deaths, a third of Georgia's workforce out of work. I'm incredibly concerned about the cover-up and the misinformation coming from China and their efforts to suppress life-saving information at the outset of this outbreak. As we continue to reopen our economy safely, we have to take steps to ensure that another outbreak cannot take hold of the world in this way. I understand CDC has worked with the Chinese CDC on global health security for decades. Can you comment on the level and the timing of the information that you received and relied upon from your Chinese counterparts as this virus emerged?
Well, thank you very much, Senator, and I want to echo how important global health security is as a national security priority for this nation, and we're going to need to be able to respond to that as long as we are a nation. CDC has had relationships with many countries around the world. We have offices in over 45 countries right now, people in over 60. And one of those happens to be China, where we have a U.S. CDC that's with the Chinese CDC. We've worked together for decades, particularly on influenza and emergent infectious diseases. And that has been a very productive, collaborative, scientific interaction. When this original outbreak of pneumonia of unknown etiology came from the original seafood market, there were obviously discussions with the U.S. personnel that were engaging with the Chinese CDC. I personally had discussions as early, I think CDC did as early as January, and myself January 3rd, with my counterpart to discuss this. So at a scientific level, we had very good interactions. I think, you know, that's different than the broader Chinese government level.
Thank you, Dr. Redfield. I have a final question for each of our great witnesses today, and it's one that my constituents often ask me. The mainstream media, and indeed some of my colleagues in the Senate, seem to want to paint each of your relationships with our president during this wartime effort as confrontational and lacking consensus. Can you categorically say here to the American people today whether this is true or untrue? From your testimony today, I've seen a very coordinated effort to address this with the administration to combat this pandemic. Can you give me a sense of whether this what the characterization is, whether it's true or untrue? Thank you. I'd ask Dr. Fauci to answer that first.
Yes, no, there is certainly not a confrontational relationship between me and the president. As I've mentioned many times, I give advice and opinion based on evidence-based scientific information. He hears that, he respects it, he gets opinions from a variety of other people, but in no way, in my experience over the last several months, has there been any confrontational relationship between us.
Thank you, Dr. Redfield. Dr. Hahn.
Again, I would echo what Dr. Fauci said. We're there to give our best public health advice, and that's what we do. It's grounded in data and science. I've always felt free to give the best public health advice that I think needs to be given at the time, and it's always been done in a very professional way.
Senator Loeffler, this is Steve Hahn.
I do not have a confrontational relationship, have not had a confrontational relationship with the president. He asks questions. I have given him my honest answers rooted in data and science, and he has listened respectfully to those, incorporating that into his decision-making.
And Brett Giroir, I have nothing else but to echo my colleagues. We work very closely together, all the scientists, all the physicians, of course, Ambassador Birx, other scientists within our group. We have a very productive working relationship with each other and also with the president and vice president. It would not be confrontational, and I certainly feel that we have the ability to honestly state our opinions and recommendations, and that's been that way since the beginning.
Thank you, Senator Loeffler. Senator